My name is Gabby Crevitt. I'm the Communications Director with the Montana Democratic Party. So first, I want to thank everyone on this call tonight for joining us. We had nearly 200 people RSVP for this town hall, which really is a clear sign of just how much Montanans care about protecting access to healthcare and food assistance. So we're fortunate to be joined by a really strong panel of lawmakers and community leaders who are here to speak about what proposed federal cuts to Medicaid and SNAP would mean for families, rural hospitals, Indigenous communities, and access to reproductive care across Montana. Before we get started, I do want to make a quick note about how this evening will run. So due to the high level of interest and participation, tonight's town hall is a webinar. So our panelists will kick things off with opening remarks about how Republicans in Washington and here in Montana are pushing harmful cuts to programs that tens of thousands of Montanans rely on. Then after that, we'll move to a Q&A session where you can submit questions using the chat box throughout the event, and we'll get through as many as time allows. So let's go ahead and get started. I just want to introduce really quickly. On the call, we have Interim Executive Director of the Montana Democratic Party, Justin Ailport, joining us, as well as our Gail Stoltz Fellow, Georgia Hawthorne, and our new Operations Director, Corey Anderson. As for our panelists tonight, we have Representative Mary Caferro of Helena, Representative S.J. Howell of Missoula, and Senator Cora Neumann from Bozeman. And I'm also very excited to introduce our stakeholders on the panel as well. We have Todd Lancashire. He is the Director of Philanthropy at the Montana Food Bank Network. We have Quinn Layton, Director of External Affairs at Planned Parenthood Advocates of Montana. And finally, Joel Rosette, the Chief Executive Officer of Rocky Boy Health Center and a member of the Chippewa Cree tribe. And before we begin, obviously we have a diverse panel. I want to make sure everyone understands that everyone on this panel has their own individual viewpoints. So there's not one viewpoint, not one person is speaking on behalf of the whole group. Keep that in mind as we're going through our discussions this evening. So thank you everyone for being here. I'll pass the virtual floor over to Representative Mary Caferro.
Thank you, Gabby, and thank you everybody for being here too. Thanks to the co-panelists. Most important, thanks to all of the tens of thousands of people out there who are covered by Medicaid expansion, as well as the providers who care for them. It's interesting. Yesterday was the birthday of Medicaid, the 60th birthday, and 1 in 4 Americans are covered by Medicaid overall, not just expansion. It's the largest single source of healthcare coverage in the United States. In '65, Medicaid was born from a vision to ensure that poverty would not be a barrier to medical care. So Medicaid's been around for 60 years. And in Montana in 2015, we passed Medicaid expansion. So it's been around in Montana for 10 years. And I think back on when it passed and when we signed it and had the bill signing ceremony, it was one of the most important days of my life. I was so happy that it passed, and to think of all of the, over the years, tens of thousands of people who would be covered by healthcare, for many for the first time in their lives. We have a successful Medicaid expansion program, and it's well supported by the public. And now I'll give you the disclaimer, kind of like what Gabby said. I wanted to give a bigger landscape perspective on what's happening, and a lot of it is opinion, but some of it I have data to back. I think that Medicaid expansion is not about saving money. It's not about decreasing our country's debt. It's not about forcing people to work with work requirements. So what is it about? To me, Medicaid expansion is about, it's political, and it's about distracting the public from the real issues facing our country today, like inflation, like not being able to buy a home because interest rates are too high, bread and butter issues. I believe that work requirements and the big, beautiful bill is more about distracting people and getting people thinking about what's going on over here instead of what's really important, which is healthcare coverage. And how does this work? It's just like welfare reform, same song, different verse. By demonizing the people who have healthcare, with a subtext that says people who have Medicaid expansion are lazy, they don't work, they cheat on their applications, they don't deserve health care. It's really a demonizing of a population, much like what's been happening with the LGBTQ community and with immigrants. And it worked well with welfare reform. I'm sure everybody can remember the terms welfare queen, the visions of women having more babies so that they could get a bigger welfare check, women sitting at home on the couch eating bonbons and doing their nails and collecting welfare. To me, that's what Medicaid expansion work requirements is about. It is not about work, and it's based on many myths. What we know in Montana is that the overwhelming majority of people who are covered by Medicaid are already working. And for those that aren't working, they're doing many important things that should count as work, and they do in Montana. We have a successful program. We don't need the federal government coming in and telling us what to do. And that's the very sad part. Is it about saving money? Well, it doesn't decrease the federal debt, like I said. And is it intentional? Is there are intentional red tape and hoops put up so that people will get kicked off of Medicaid? It seems to me like I can't say what the intent is, but I do know what the outcome is. And I know during the session, there were efforts to cut the Medicaid expansion budget, anticipating work requirements going into place. Now, if there was a seriousness about this issue, there would have been money invested in infrastructure to make sure that everybody who had Medicaid expansion was able to keep it. And what I mean by that, there was an amendment moved by a senator, or I mean, a representative from Billings, a Republican, not a Democrat, that cut the Medicaid expansion budget by $32.5 million. $32.5 million. Of that, 3.2 was state match, and it would have drawn down $29 million. So the overwhelming majority is federal money. Everyone knows it goes to cover healthcare, goes into every corner of the state to pay the providers so that they can provide the care. If they weren't anticipating, and if the Republicans, because the Democrats didn't support it, and there were many Republicans that didn't either, but that's an example to me of what the work requirements are really about. It's not about work. It's not about requiring people to work. It's about putting up hoops and red tape so many people get kicked off. And it's about this political narrative that demonizes a population that does not deserve to be demonized. Thank you very much.
Thank you, Representative Caferro. Up next, we have Senator Cora Neumann.
Thank you, Gabby. I'm very honored to be on this panel with some of the leaders across the state that I respect more than anyone. So I feel really in really good company. And I really appreciate, Gabby, all your work and your team's work for putting this together. The reason that this is so timely, as Representative Caferro mentioned, was Montana is on the cusp and is actually in the process right now of expediting what was passed in the Trump budget reconciliation bill, which was the one big beautiful bill. So many of you may have heard about Medicaid cuts, which were part of that bill, that are wildly unpopular all across this country. Every single congressperson and senator that voted for that has people in their districts that are going to suffer, and in their states that are going to suffer, but they passed it anyways. And I want to just zoom out for a second and explain what that means. So they are not cutting Medicaid directly per se. The way they are cutting Medicaid is by making it so hard for people to stay on, and making the process of getting authorized and staying on so cumbersome that they anticipate enough people will fall off and be kicked off of Medicaid that's where the cuts are going to come from. So just to kind of put that in context, we do have some control over the outcome here. We do have, and I'm so grateful to Representative Howell and Representative Caferro for helping lead the charge on passing Medicaid expansion. We do have Medicaid expansion in this state, and that is exciting. And it's a great win for us. We have to remember that we have that. What we're up against now is that the federal government has pushed to as Representative Caferro reviewed, require work, even though the majority of people on Medicaid are already working. It's also going to require reauthorization every 6 months, which is a huge burden on people. You know, those who are on Medicaid are on Medicaid because they need health care and they are struggling to make ends meet. And there's no one in this state, well, no one I know in this state, and I grew up in Bozeman, and have watched these massive changes happen to our state. No one I know would refute that Montanans are struggling to make ends meet, that between inflation and housing costs and lack of childcare, people are struggling to make ends meet. And so Medicaid is covering people who are working really, really hard. And these work requirements are adding paperwork. It's like I keep saying, calling this bill death by paperwork. Really, it is requiring that people reauthorize every 6 months and that they fulfill 80 hours of work per month, and that it can include education and community service and caregiving. There are some, and we can go through in detail the exemptions, and I'm happy to run through that. But the challenge that we've seen in Montana, and the reason that pushing this, so what Montana wants to do now, this 1115 waiver, right? So the federal bill passed, and now Montana is introducing the 1115 waiver, which is asking the federal government to allow us to put these work requirements and 6-month reauthorization, as well as all of the other requirements, which includes co-pays and premiums, into place a year before it's required. And why is that a problem, especially in Montana? Because we saw during unwinding, and I think everyone on this call can talk about what happened during Medicaid unwinding. 120,000 people, or maybe I think even more, were kicked off of Medicaid during unwinding, and the majority, or a very large portion of them, were kicked off because of administrative errors. Montana is currently dead last in the country, 50th in the country for lag time in processing Medicaid applications, income-based Medicaid applications. 60% of the applicants and the people who submit paperwork to be processed for income-related coverage, 60% of them, it takes 45 days or longer. So we are currently, our system to keep people on Medicaid is the worst in the country, and yet our state is looking to expedite that process by an entire year. And so the reason this is so timely is because we actually have an opportunity right now to make our voices heard and to actually go in and testify. DPHHS has just opened its comment period. They're taking in-person and virtual testimony over the next few days, and then you can submit your comments through August 18th. And so that's the high level. I'm happy to go into more detail, Gabby, but I think let's go around and hear from everyone. But to get into more detail especially about the Medicaid unwinding, what is required, because I know people have a lot of questions about that and it's pretty confusing. But that's really one of the reasons we wanted to get everybody together today, was a call to action to slow this process down and the state of Montana needs to prove to us that they're ready for this. And they have not done that yet. So yeah, thanks for having us.
All right. Thank you, Senator Neumann. Joel from Rocky Boy Health Center is up next.
Tante Kiowa, ano ako magtik katamskat kinawa. Joel Rosette, Nitsi soon. Asani Watig. My name is Joel Rosette. I'm the CEO of Rocky Bay Health Center. I'm happy to be here to talk about the One Big Beautiful Bill and its impact on tribal communities. And I could speak just specifically from Rocky Boy, which is located in north central Montana. We serve about 5,000 patients in our area. And the biggest thing on this big beautiful bill that has come out is it affects rural healthcare, and that's our biggest concern as serving a rural population. American Indians and Alaska Natives were were excluded from these work requirements, and we felt definitely excited that we were excluded, and those were based on treaty obligations and trust responsibility as the federal government, as we paid for those through loss of land, loss of area, these health obligations that the federal government has for us. And Medicaid is used as a stopgap for the lack of funding through IHS. At Rocky Boy, we took over these services from IHS, but we're severely underfunded for the patient population we serve. We're heavily reliant on Medicaid, so Medicaid disproportionately affects tribal communities in a number of different ways. And really, I wanted to make sure that everybody understood that. It feels bittersweet to be exempted, but to see our Montana residents and folks we work with, providers and rural communities be impacted so heavily. So we feel those impacts. We are heavily reliant on Medicaid to provide additional services, to see these changes that have happened in our community. So it's tough to be on here with you folks and see such the swath of change come so quickly. But we want to make sure we were on here to support as well because we're reliant on it. As tribal citizens, we wanted to make sure, you know, the amount of Medicaid that comes into our communities is huge. 50 to 60% of the budgets have been impacted, will continue to be impacted by this. We are proud what we've achieved because of Medicaid in our community. We've been able to add additional services from the preventative services. Prior to Medicaid expansion, healthcare among Indian communities was a struggle, dealing with just having IHS funding available. We've been able to add these additional services and be able to really promote the preventative healthcare. As you guys know on this call, American Indians, we suffer from the highest in this. I don't need to go through that with our medical issues that we've experienced. Having Medicaid as a stopgap has really allowed us to cut into those statistics, from hypertension to longevity, all these different things, cancer rates. We feel those, and we know Montanans do as well in these rural communities. And Medicaid has allowed so many of these folks to get preventative services that were long missing. I also think about on the behavioral health side, with the amount of changes in our communities from fentanyl to opioids, it's really changed the services we got to deliver in these rural areas. And mental health is important. Not having these for this population, you're going to see a lot of changes happen within our communities that we're not ready for. So I just wanted to reiterate the effect of these Medicaid cuts still hit Indian country. We rely on Havre, Great Falls, Kalispell, Billings, these communities to provide support services. If they're no longer working with Medicaid clients or they're no longer open, that affects our services. I think of this Medicaid as, we're all part of this hive, and we're not able to all access that hive. That's going to affect us all. So that's how I see this. It's not just a Montana Billings issue or Missoula. It's the whole state from rural to our urban areas. Challenges in clinics and indigenous communities already face. I mean, as I said, we face historical and current public policies that have created geographic isolation, reduced economic activity and job opportunity, and lack of quality infrastructure. Healthcare was a part of our treaties, never been fully provided or funded. Regardless, at Rocky Boy, we've been able to use these tools, these Medicaid tools, to build. The big beautiful bill will have clear short-term consequences and ones that will slowly creep in over time. We've talked about 10 years and different things. And because these Medicaid cuts were delayed, when people start losing their coverage, many from rural areas will forget how it came to be. We probably, as far as Rocky Boy, we have over at least 50 to 60% of our membership on Medicaid. We also have our highest insurance coverage on the reservation. We're really proud of how that Medicaid has seeped into our insurance. They graduated from the Medicaid and moved on to private insurance. Some of the things we've discussed with our federal legislators overall was how this is a rural issue and how our legislature came through. This was amazing, the work that was done to get Medicaid expansion passed this past year. I wanted to reiterate that's the popularity of the Medicaid expansion, how it impacts all of Montana, that we needed to support this. So rural healthcares operate on a tight budget. Medicaid covers many of these hardworking patients, including farmers, small business owners, wildland firefighters, home health aides. And I think that with this complicated paperwork, I talked about it with on our tribal coverage, the bureaucracy of signing up for Medicaid. I don't know who would come on and commit fraud on a 30-page application. I mean, it's wild for me to think how much fraud goes on with these coverages because it's so hard for average Montanans to get on there and just actually get through this. It's just another way that potentially is going to impact our people people that most need it won't be able to access this, especially those dealing with addictions, dealing with the mental health crisis, those folks that are most vulnerable. I see it tough getting these 20 hours and meeting these exemptions. I really worry about the exemptions for those that are most vulnerable. Healthcare is a system that works to keep our community healthy. Even if you don't have Medicaid as your insurance, we all travel this big state. I just traveled from Whitefish back to Rocky Boy today, and it's long. And when an emergency strikes, every minute matters, and losing our rural providers will put us all at risk. I was driving through Chester. I was worried about our folks at Chester, worrying about our folks at Cut Bank that their Medicaid clients are able to access those services in these rural places. I I just don't want to take too much time, but how indigenous communities, these tribal communities, have been thankful for the work that's been done by all of you to make sure we're included on this. And we want to make sure that every Montana has that access as well. We were exempted from these work requirements. We want to continue to support everybody else as well, though, because we feel most a partnership with all the folks that rely on Medicaid. So I'll leave that and let the next presenter go. Thanks, Gabby.
Thank you, Joel. Next, we have Quinn from Planned Parenthood Advocates of Montana.
Hi, everyone. Again, thank you so much to everyone for being here and to the Democratic Party for pulling this together. I'm really honored to be on this panel with so many other incredible people. I want to talk a little bit about the provision in the reconciliation bill that defunds Planned Parenthood and other any provider who fit into the language that was in that provision. So essentially it prohibits any person covered under Medicaid from accessing any form of healthcare at one of our health centers. And you know, we fought it along with affiliates from across the country, but unfortunately, you know, we couldn't break through, and there were attempts made by numerous Congress people to try to amend it out, but it just didn't work. And so what this means is, unfortunately, that some people are no longer able to access healthcare from their chosen providers. And in many cases, they may not be able to access care from the only place in their community that accepts Medicaid. And so it's been a difficult situation to navigate for our health center managers and teams, but they've been well equipped with resources and messaging and doing their very best to, you know, communicate with our patients and provide the best resources, and do everything we can to make sure that every person who comes through the doors of our health centers can get the care that they need. What I do want to reiterate is, I think the word defund, it can be confusing. And so it does have the impact that I just lined out, but really what it was and what it is is a backdoor abortion ban. So it is an attempt by extremist anti-abortion lawmakers to shutter the doors of health centers who provide abortion. So the way this was framed, approximately 200 health centers with Planned Parenthood could potentially close. Approximately 90% of those health centers are in communities where abortion is legal. And 64% of those are in rural areas where abortion is legal and also medically underserved areas. So that's really what this is all about. While it also has those like ripple effects of denying people care like cancer screenings and STI treatments, access to birth control, wellness exams, all of the care that we provide, and without using the word abortion ban, they are trying to ban abortion. So it's been a difficult few months for us, but we are navigating it together, and we will always make sure that our doors stay open for everyone and figure out how to do that and make sure that people have the care that they need, or at least make sure that we can refer them to another health center where they can receive that same good care. So again, having, different conversations and just working together as a team and making sure that we can continue to provide the high quality care that we always have and will continue to do. So I will stop there. I know we have a lot of other good conversations and some time for questions.
Thank you, Quinn. I want to remind folks that our chat box is open. Feel free to drop questions in as you're listening, and we'll make sure to get those during our Q&A session. So go ahead and put those in now. Todd, take it away.
Thanks. Or drop into the chat box when I start citing too many numbers and percentages here. You can let me know. I'm really honored to be here. Gabby, thanks to you and your team for making this happen. I'm going to talk about SNAP. I'm going to talk about dollars and percentages, but from my world in food insecurity, this is not a conversation about money. It's a conversation about values. I hold the value that all Montanans have the right to equitably access the nutrition they need to lead healthy and vital lives. I just had lunch today with the executive director of a food bank in Montana who said, while the details are complicated, the reality is heartbreakingly simple. More of our neighbors will go without food. I'm going to speak quickly and share some numbers because I think in the end, my call to action has to do with understanding the potential impact and an opportunity for us to, as a state, to help move the needle on some decision making that's coming down the road. As far back as 1964, our country recognized the need to create food security systems and the possibility that these same systems support farmers, ranchers, and local economies. I think too often we fail to recognize that initiatives like SNAP simultaneously provide critical public health interventions while also stimulating our economy and supporting our farmers. Of course, this cuts both ways. So when programs get cut, those benefits also go with them. Just to give you a sense of SNAP, last year, our country spent $100 billion on SNAP, and $94 billion of those was issued to families directly in the form of monthly benefits. The USDA has estimated that for each dollar in SNAP benefits, we pump $1.50 back into economic activity, which last year would have translated into $141 billion in our economy. Structurally, 100% of SNAP benefits come from our federal budget, and the administrative costs to execute the program have been split 50-50 with each state. Because there's so much money in this program, of course, we audit it, and this is only important because some of the big changes that are coming have to do with errors and calculating, and then states paying penalties for making those errors. And those errors are errors of underpayments by state, overpayments by state, and then there are also errors as Joel Rosette spoke to, I think, of just the forms being so complicated that things don't get submitted, they get submitted incorrectly, and those are all counted as errors. And those are done in an audit, just like we know the IRS does random sampling and does audits. Last year, Montana had an 8.89% error rate, and in a moment you will hear why that number is important. Last year, just to give you a quick snapshot of what happened in Montana, 81,500 Montanan residents received SNAP benefits. That's 1 in 14 Montanans. And to give you a sense, 1 in 8 Montanans are food insecure. So there's an important gap there as well. 63% of SNAP recipients are in families with children, 38% in families with older adults, and 43% are working families. And 30% of the recipients in Montana have a household income that's less than 50% of our nation's poverty line. The major elements of the changes in this bill and their impacts are really too many to detail. I'll rely on Representative Howell to help me with some of those, but I do want to highlight a couple. Our best estimate at this point is that with the changes, up to 30,000 Montanans may lose their SNAP benefits with these changes. That's 37% of the total current or 2024 SNAP recipients. Broadly, these changes include increases to the cost to administer SNAP in our state. That will go into effect in the future. SNAP is now limited to citizens and green card holders, which is enforced now. There are now expanded work requirements, as we've heard already about around Medicaid. There's a prohibition on USDA for making future increases in benefits based on anything aside from the cost of living. So not including new science around nutrition standards or even food purchasing patterns in our state. More restrictions on the calculations around household income, so utility costs, all of those things, there's changes there. And none of these changes are working in favor of the value of ensuring that all Montanans have the nutrition that they need for themselves and their family. And it also includes eliminating funding for nutrition education, or what's called SNAP education, which is really important just in terms of helping people understand what's available to them. So let me just highlight a couple of the impacts here. Increase in cost to our state. Starting in fiscal year 2027, Montana will be responsible for 75% of the SNAP administrative cost, which is up from 50%, 25% increase. Today, that would be a shift from $14 million in its cost to $22 million. So these are significant numbers. Starting in fiscal year 28, if Montana's error rate is over 6%, remember it was almost 9 last year, we will pay a penalty based on our SNAP allotment. In 2024, Montana's SNAP funding was 170 million. So for error rates, I know this is a lot of numbers, between 6 and 8%, the penalty is 5% of that total 170 million, and it increases from there, from 8 to 10%, and then above 10%, up to paying 15% as a penalty. Under this system in 2024, Montana would have needed to pay a penalty of $16.7 million. And if we bumped up over 10%, that would have been $25 million. So the impact that I see is I have a fear that these costs may get so high that Montana may opt out of SNAP. SNAP is optional, or we will have to pull that money from that to pay those penalties from other places in our budget, which we need them desperately. Or we reduce the SNAP services available, or we make it again so complicated that it drives down the number of participants, thus saving money. All of the changes that I just discussed really quickly, and as others have discussed in terms of the complication of navigating these systems, most certainly will drive the error rates up. We've heard a lot about expanded work requirements, so I won't go into those, but they exist within SNAP. All of them, again, make it more difficult for individuals who can access them and who can receive benefits. Other exemptions have been removed or narrowed for groups like veterans and unhoused individuals. And there's more limits on states waiving requirements. And these changes do not adequately address the realities of employment in Montana. They ignore, among other things, the real life challenges of caregiving, part-time, seasonal, less predictable work schedules, and interruptions due to things like health issues. As SNAP work requirements and income calculations become more complicated, error rates increase, and the gap between families who are food insecure and families who receive SNAP benefits will grow simply due to the challenge of navigating the system. So as you've heard already, the simple but really critical call to action is to write letters, make phone calls, attend town halls like this. But there is a moment coming in the next couple of years where I believe our state will make a decision about how it manages SNAP, and we all have a chance to influence that decision.
Thank you, Todd. It looks like I misspoke. Please put your questions into the question and answer box, not the chat box. That is disabled. So as you have questions, the question and answer box. Up next, we have Representative Howell.
Thanks so much, Gabby. Real pleasure to be here. Thanks everyone for joining. Todd went into a lot of details about the impact on SNAP, and I'm just going to hit a few of those details in terms of what it's going to mean at the state level and what legislators are going to have to grapple with in the coming years. Just as a reminder, SNAP is about food access. Right, the average SNAP benefit is about $175 a month, and anyone who's been to the store lately knows that that is not going far enough. Todd mentioned that a big chunk of households in Montana who receive SNAP are households earning less than 50% of the federal poverty limit. For a family of four, 50% of the federal poverty level is $17,575 a month. $17,575, sorry, not a month, a year. So we're talking about folks who are grappling with really serious poverty and in really hard places. And SNAP is a way to help just a little bit so that families aren't choosing between putting shoes on their kids' feet or food on the table, right? This is a crucial way that we show up for our neighbors. And in Montana, 81,000 of our neighbors rely on SNAP, and up to 30,000 of those could risk losing some or all of their benefits under this bill. That is a huge impact. So I want to just briefly touch on some of what Todd spoke about. So what HR 1 does, the BBB, first of all, it creates the largest cut to SNAP in the history of the program. And estimates are that, without substantial changes, the SNAP program across the country could be reduced by up to 20% in the next 10 years. So we're talking about 1 in 5 SNAP recipients across the country no longer getting any food assistance a decade from now. Second, for the first time ever, states are going to be required to pay part of these costs. Now, as Todd talked about, this is framed as a penalty for administrative errors, but let's be clear, there are always administrative errors. And you heard what Senator Neumann and Representative Caferro talked about, the increased work requirements and redetermination requirements with Medicaid. Well, guess what? The same department that has to deal with all of that paperwork also deals with SNAP paperwork. When you pick up the telephone to call and get help, if you are trying to get help with your SNAP application or trying to get help with your Medicaid application, it's the same phone number. It's the same set of state workers who are frankly underpaid and overworked, having to deal with a massive amount of paperwork every month. So there's going to be administrative errors, right? And look, I'm in favor of good governance. So you might think that this penalty for administrative error would incentivize states to do better and to make fewer errors, maybe to cut down on red tape. But of course, that's not the end of the story, because also, as Todd mentioned, the federal government is going to now pay half of what they have been for the cost of administering the program. So states get less money with which to administer the program, and then have to pay for when there are inevitably more errors. This is a system that is designed to fail, and it's designed to fail by ratcheting up the costs on states who may or may not be able to afford it, or may or may not choose to afford it, and then allowing those states the option to cut benefits or limit options or opt out of SNAP altogether. I want to take just a minute to put some details on the SNAP work requirements, because just like what we're seeing in Medicaid, we have an increase to work requirements in SNAP. So previously, work requirements only existed for folks between the ages of 18 and 55. Now that goes all the way up to 65. So man, if you get laid off at 63 and you can't find a job because, age discrimination is a thing, you're out of luck. Caregivers with kids 14 and over are now no longer exempt from the work requirements. Veterans, homeless folks, former foster kids, all no longer exempt, all also having to meet these work requirements. And just as a little bit of a side note, kids in families who receive SNAP now have an automatic eligibility for free school meals. And if their families lose SNAP, they're going to lose that automatic eligibility for free school meals as well. So really, pretty tough times that we are putting families in. Again, families, a family of 4 making $18,000 a year. That's what they're going to have to deal with. And the last thing that I'll say is that the reason that this bill was created, a bill that every single member of our congressional delegation voted for, was not to cut our deficit, because of that. Of course, that is going up by trillions of dollars in the next few years. It's to give tax cuts to the wealthiest Americans. It is quite literally taking food off the table from hungry kids and hardworking seniors in order to give billionaires a few more bucks for their bank account. And I can't personally think of anything much more craven and much more cruel than that. So I'll just end by saying, this bill has passed. We're going to have to deal with it. And one of the ways we're going to have to deal with it is in the state legislature in the 2027 session, when we as a state have to prioritize spending the money to ensure that we are not letting SNAP benefits slip away for Montana families. And we're going to need to make sure that we're doing it in a way that doesn't increase bureaucracy and increase red tape for these families. So I encourage you all, not just to let the congressional delegation know how you feel about this, but to keep your state legislators in mind as well, because we have some pretty important work coming up ahead of us. And I think we need all of us to be engaged and sending in messages and letting folks know just what a priority this is. I'll let you know right off the bat that Montana Democrats, we're going to be fighting for this. This is going to be a priority. It always has been, and it certainly will be. But we need every Montanan out there to be picking up the phone and making calls. Don't wait until January 2027. Start now. So I'll stop there. Thanks so much, and happy to answer any questions if folks have them.
Great. Thank you, Representative Howell. So we're now in the Q&A portion of the town hall. We already have some questions queued up. Folks can continue dropping those questions in the Q&A box, and we'll get through as many as we can this evening. Georgie is going to help us sort through some of those questions. Georgie, do we have our first question lined up?
We sure do. So someone said that Clark Fork Valley Hospital in Sanders County has said that they're not going to be affected by these cuts because of Medicaid expansion and the way that there's cost sharing between the federal and the state government. Does anyone have any info on how Cora has info on how cost sharing works? Go for it.
So while I do want to, what I want to share is that there is at this point in time a list of 8 rural or critical access hospitals that could be forced to close if the waiver goes through. So that's the Northeast Montana Healthcare in Poplar, Prairie Community Hospital in Terry, Garfield County Health Center in Jordan, Logan Health Clinic in Cut Bank, and as Director Rosette mentioned, you know, that's a lot of these are also hospitals that serve both rural and tribal communities, as well as Bighorn Hospital in Hardin, Northeast Montana Health Services in Wolf Point, and Big Sky Medical Center in Big Sky. So that's I can share that those are the hospitals in Montana at this point that are concerned with and very likely to potentially close. And I don't know if Representative Howell, if you want to say anything more about cost sharing with the hospitals specifically, I can speak a little bit more to if you mean by cost sharing the co-pays and potential premiums, then that's something that I can speak to. But I don't know if Representative Howell has anything else on the.
You know, I'll just say specifically the FMAP, or the matching rate between the feds and the state, is not changing at this point. And that's pretty important for Montana because we have a trigger in our law that would create some changes if that did change. I think what I would say, you know, what I think is really concerning to rural hospitals is just seeing a reduction in the number of people who have any health coverage at all, people who lose Medicaid or who lose their marketplace coverage, but still have to show up to that rural hospital and get care, usually in the emergency room, the most expensive type of care that hospitals provide, with nobody paying the bill. That's what puts hospitals at risk of closure. And I think we're going to see that regardless of cost sharing, because people will lose coverage.
Yeah, and they may lose coverage. They may also, when the co-pays kick in, just not be able to afford the co-pays, right? So I didn't mention at the beginning, but my work outside of the legislature is with the Native American Development Corporation. So I help oversee health programming there. And we have an urban Indian health clinic, the Billings Urban Indian Health and Wellness Center. And there are urban clinics across the state. And what we saw during unwinding was that when people were, you know, and I do want to also share, speaking of the system being broken and not ready for us to expedite this process, there are people who were kicked off during unwinding due to an administrative error who are still not back on. And those are families, right? Those are people who are caregivers, children. And one of the things that we saw at our clinic was, you know, elders foregoing care because they couldn't, and I want, Joel can speak more to this as well, but when those costs go up, not only when people lose coverage, but then health costs like co-pays and premiums that can kick in will also keep people from going to the hospital. And those are the kinds of things that really hurt all of our hospitals.
Thank you both. Someone also asked, does anyone have any information about how food banks and other community nutrition enterprises are preparing to deal with this cut to SNAP?
Todd, do you want to weigh in on that one?
That's probably me. Yeah, I think we're all doing whatever we can. A lot of the nonprofit food banks in Montana rely on public funding. They rely on private funding, foundations. I spend a lot of time on calls with foundations who are ready to jump in, but they also recognize their capacity relative to, say, the size of the USDA budget, which is completely insignificant. So there's a lot of fear there about the long term. Food banks that I have talked with recently, they're already preparing. They're ramping up for the increase that they expect to come with all of these changes. So they're already adding an extra pantry day where individuals can come in and shop within the food bank because they know it's coming and they want to work out all of the systems before it actually gets here. So they're doing everything they can on the ground to prepare while also watching their costs increase because of increased demand without knowing where a lot of that funding will come from in the future.
May I add, Georgie? For years, Montana had funding for food banks that came out of the TANF budget, and the original amendment was sponsored by, at that time, Senator Zinke and myself. And then former Senator Bob Brown from Whitefish was really helpful. And $1 million a year out of TANF funding that went to, you know, be dispersed to the food banks across the state. And so this session, I successfully moved an amendment through the legislature, supported, greatly supported, to again fund TANF, use TANF funds, surplus, by the way, that's sitting rat-holed away, $1 million per year to go to food banks. Really important, especially in considering what's happening. And the governor vetoed, line item vetoed that funding.
Thank you. Someone asked, is it likely that the Montana legislature would need to convene a special session regarding Medicaid coverage before 2027?
I'll jump in and say, I personally think it is unlikely. I think we will likely not see a special session this interim unless, or at least I think we will not see one for Medicaid or SNAP changes. That's in part due to the timing of when these changes might take place, and also because they're likely not going to impact this biennium's budget. But Senator Neumann, Representative Caferro, please jump in if you have other opinions.
Great. Someone asked, when is the federal government planning to initiate these changes in Medicaid? What does that look like on the state level? And if someone could elaborate on what those work requirements actually look like.
I'm happy to do that. I was part of my plan, but I rushed through my remarks a little bit. So let me review this, and Georgie did actually share this in detail because I think it's important to have this on hand, especially hopefully everyone on this call is gonna get off this call and sign up to testify in the next couple of days or weeks on this. But so 10 things to know about the draft waiver. The work requirements for coverage include that will stipulate that most adult Medicaid enrollees will need to complete 80 hours per month of work, job training, school, or community service to keep their coverage. Now remember, people are already working, right? So what this is doing is just adding more paperwork, again, to people who are already struggling to make ends meet. There are exemptions for certain groups, as Joel shared. You may be exempt from these requirements if you are American Indian or urban Indian, pregnant or postpartum, if you have high medical needs, so if you're considered medically frail or have a serious medical condition, and I did see a question about someone recovering or struggling with cancer, a caregiver of a young child. I think in Montana, they're going to make that younger than at the federal level. I think federally it's under 18, and Montana is going to push to make it under 13 or 14. Or you're caring for a disabled family member. If you are a veteran with a disability, foster youth in Montana, I think they're asking for under 19, or you're receiving inpatient care. One thing that I want to appreciate the wins. I will say that Montana is also asking to include in the exemptions people who are struggling with homelessness, domestic violence, are in the corrections system. And I think they're traveling for medical care. So Montana is trying to put in additional exemptions for people, and I want to make sure that we're also celebrating and encouraging those things that are going to be good for the Montana population. Overall, it's still not good, but there's the income-based exemption. So if you earn at least $580 a month, or average that over 6 months as a seasonal worker, you are considered compliant and you don't have to report your activities, but you still have to prove, right, that you're working. There are going to be strict compliance checks. So what I didn't say at the beginning, or I'll say again, is that you have to apply and get yourself reauthorized every 6 months. So that is going to be required for everyone other than those that are exempt. If you do not report or qualify for an exemption, it can lead to denial of or termination of Medicaid. And this is something I think we need to make sure to pay attention to. It can also lead to a ban on marketplace subsidies. So you could be kicked off of Medicaid and lose the ability to get ACA marketplace coverage. And Howell, if there's Representative Howell, if anything I say is wrong, you chime in. Monthly premiums are also going to be introduced. So this is the cost sharing, right? The waiver proposes premiums of 2% of income, increasing each year up to 4% if you're on Medicaid long-term. And so there's co-pays and premiums. Co-pays will be required. Those are pushed off. So the federal work requirements are going to go into place December 2026. Montana's pushing to start it in January, which we are under no circumstances ready for. So that's the year difference. I think that was the heart of the question that was asked. Copays will be required starting in October 2028. So the state will have to charge copays for services like non-emergency doctor visits. SUD, substance use disorder, and primary care, hopefully, we hope will be exempt from that, but copays for everything else. And then unpaid premiums, once those kick into place, are going to have consequences. So if you don't pay your premiums and you're below the 100% federal poverty line, your tax refund may be garnished. Right? So this is just punishment on top of punishment. If you're between 100 and 138% of the federal poverty line, you could be disenrolled, so you'll just get kicked off. There are some hardship exemptions and some other, like natural disasters or high local unemployment, but for the most part, this is going to apply to everyone. And the thing about this, and I feel like Todd and Representative Howell alluded to this when it relates to SNAP. The goal of this is to make it so hard for states to comply and for individuals to comply that the federal government can turn around and say, it's your fault. It's your fault you lost coverage. It's your fault you lost SNAP. It's your fault you lost Medicaid, which is also a psychological game. And I just want to, I kind of want to bring that up because I feel like it's important. As I listen to everybody's stories here, it's excruciating. I'm lucky enough to have health insurance, and to have food on the table, but these are real people, and this is going to be really, really painful. And not only is it going to be painful, what we're hearing from the federal government is it's your fault. You are to blame for losing your coverage. And so the whole thing, I feel like, is just punishing hardworking Montanans, and that's it. So, thank you for letting me run through those, but I do think it's important because the devil is in the details here, big time.
All right, we're going to get to a few more questions. We're going to go a few more minutes past 7. So we'll get to a few more questions and then wrap up. Georgie, what's next?
Yes. How can the legislature raise the bar for the Department of Health and Human Services when it comes to improving administration, reducing errors, making sure that constituents get these critical services?
May I?
Go for it.
We tried. I mean, we have tried and tried and tried to get to hold the department accountable, to support the department with funding, to do good governance. And I mean, this goes back a long time. I think it was 2012, 2004, no, 2013 and 15 is when I first started on this. And then the Democrats had a Medicaid expansion bill, and the Republicans did this session. And in our bill, there were provisions that were specific to, for one thing, providing funding to the department, and number two, to make sure that they came into this century with their eligibility system. And it was modeled after Oklahoma. Oklahoma has the #1 system in the country, and has for a long time, for processing applications accurately and in a timely manner. And then, like, I think that maybe Senator Neumann said, we're worst in the country. And so Democrats have tried. We have tried so much. And then I think that there was something that passed that was your bill, Howell, that maybe will be helpful, but I'm telling you, money. And we also had in our bill to reopen the rural offices of public assistance so that people could actually walk into a place and get help, especially important in places where there is no internet. And our bill, it died, but I want people to know we have been trying and will continue to try. And if you can remind me, how I think that your bill, I'm sorry, I can't remember. Didn't you have a bill that did some kind of efficiency?
Yeah.
Portal.
So Mary's right. I mean, we had a bill that had a lot of really good ideas, and I think that we should be holding on to those ideas and keep trying. The bill that did pass was a bill that created what's called an assister portal, which is legislator language for a website that folks can use if they are helping somebody else with their Medicaid application. So an organization or an individual can be designated a helper and then can get online and help with the paperwork, help deciphering what the language of the department is. I think this is going to be really important. I hope that it will be helpful in ensuring that more people can get in and make sure that folks aren't losing their coverage just because of red tape.
Great. So I think this is our last question. Gabby, correct me if I'm wrong.
On our last question.
All right. Could someone explain the impact of these Medicaid cuts on young people specifically, and in turn, what that might look like for Montana's future moving forward?
Mary, do you want to speak to that, or I feel like any of us can, but. I mean, I think what I can say is what I know in my community and communities across the state, there are a lot of seasonal workers, a lot of part-time workers, a lot of young people who are, trying to make ends meet and even cover their rent, right? And so this is, I think, gonna have a disproportionate impact on young people because of their, what we're seeing here in my community, but is young people having to move a lot because their houses are being sold out from underneath them, the houses that they are renting, right? And so being able to keep on top of this paperwork and these work requirements, and if you're piecing work together, think about how many different proofs of employment you're going to have to put together to submit. And so it is, I think it's going to have a really significant impact on Montanans. And I think that's going to it is going to impact our economy and the ability for young people to thrive. And whether or not they decide to buy houses or can buy houses, I mean, right now it's completely out of reach, but have children, stay in the state. I don't know, Quinn, maybe you have a few thoughts on that as well. You work with a very diverse group.
Sure. I mean, yes, I think that young people are one of the key demographics that are going to be most disproportionately impacted. And I think, we see and work alongside like more like teenagers and young adults. But I think that this conversation can also go back to the attack on SNAP and like food security. And obviously that will result in negative health outcomes if, kids can't eat or families can't provide food for themselves. But yes, I think that also when young adults who may be on Medicaid or ACA can no longer access like birth control or STI testing, abortion care or gender affirming care if they need it, then that has adverse impacts and also may result in more young people like trying to figure out how to leave Montana, but also like this is not just a Montana issue, right? Like we're looking at a lot of these impacts across many different states. So it could be different in some different states, but also it's likely not. And I did want to add that I think I failed to mention this. There is a preliminary injunction in place. So people with Medicaid right now can access care at Planned Parenthood, but with any litigation, we're hoping it sticks, but like there will likely be appeals. So, young people can come in, all people with Medicaid can come in right now, but we don't know what that looks like long term. So I think that, folks are right to be worried about the impacts to young people and what that looks like for future generations. And I don't know that any of us have the exact answer, but we are likely all concerned.
Super quick. Young people are more likely to work in places that don't offer health insurance.
Sorry, Mary, I was going to chime in too. It's hard enough to get them into our building, the young folks. and a lot of them don't have coverage. We had a young couple, tribal couple living off the reservation, both working, couldn't qualify for Medicaid, but children were covered by Medicaid, but they had their own medical issues. So I think really working with our young folks to get them on it's tough and cumbersome, like we talked about. So I really think they'll be impacted through this. Getting young parents to do all these as well. I think about those folks having babies. You know, those early 20s could really impact our system, our health system overall as well. So
Thanks, Joel. Alrighty, that concludes our Q&A portion of the town hall. If you have any lingering questions for one of our panelists, I'm going to put my email address in the chat box, so you can leave your questions with me. I'll try and track down one of our panelists. I believe, Cora, you had one more call to action. You
I already
wanted to
said it, but I'm just gonna say it one last time. Right now is the moment to submit testimony and actually testify as well. And so please submit your comments. We just, Georgia shared the outline of the impact of work requirements. And I hope that we can stay in touch when there is something to do for SNAP. On that, if there's a call to action, I don't know, Quinn, if you have one, but please, if you can, we should be flooding the state. There is absolutely no reason for us to rush this process. We need, if nothing else, a sister portal that was set up by that was passed, the bill passed by Representative Howell, that won't even go into effect until May. So at the very earliest, but really we don't need to rush. And so I just can't emphasize enough how important it is for everyone to make their voices heard and say, please don't make Montanans, suffer. Really, this is going to make Montanans suffer, lose medical coverage, go hungry. It's really, really dire. So I just, one final plug. Thank you so much.
Yeah, and it's in the chat now, but there's a website that we're continuing to push out to folks to support Planned Parenthood during this. And it's just www.imforpp.com. And we are also asking people, if you are not already and are interested, to become patients at a Planned Parenthood health center that also helps support our work, or consider donating, and just or also potentially being a storyteller if you are a patient and willing to share your story about accessing care. So yeah, that's my plug too. Thank you.
All right, thanks everybody. We appreciate you joining us tonight. Have a great night.